Hello and welcome to Good Life, the health show with me, Pooja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle and much more. Well, viewers, of the 37.9 million people living with HIV at the end of 2018, 79% received testing, 62% received treatment and 53% had achieved a suppression of the HIV virus with reduced risk of infecting others. And thousands of community health workers and members of the HIV and key population networks, many of whom are living with HIV or affected by the epidemic, contributed to this success. Well, viewers, on World AIDS Day 2019, WHO is highlighting the difference these communities are making to end the HIV epidemic while drawing global attention to the need for their broader engagement in strengthening primary healthcare. And we here in studio will highlight some other important facts to aware people. And to discuss, we have with us in studio Dr. Borah, former regional coordinator, National AIDS Control Organization, and also we have with us in studio AIDS activist Jahnavi Goswami, the first woman to publicly declare her HIV positive status, and now she has become an inspiration for many women in the state. So not to waste any more time, I'll straight away move to my guests who have just arrived in the studio. All right, thank you so much to both of you for coming to Good Life, the Health Show, and we are going to talk on AIDS because it's World AIDS Day coming ahead, and we are going to celebrate this week as International World AIDS Day. So first of all, Doctor, coming to you, if we talk in general that what is HIV AIDS and what are the main roots of HIV infections, so what would be that?
Yeah, thank you. First of all, I wish on the Eve of World AIDS Day, I wish our Jahnavi and all the communities suffering from HIV AIDS, and I send my heartfelt gratitude to those who lost their lives. So HIV is basically, it is a virus, it is a retrovirus which was detected in 1981 in Los Angeles among the homosexuals. And in India, in particular, the first case was detected in 1986 in Chennai.
Okay.
And in a female, female sex worker. But I think at that time, nobody thought that it will take an epidemic role, even a pandemic role. Now it has spread to all over the countries in the world. So basically, the main cause is the route of transmission.
Okay.
The main route of transmission is the heterosexual route of transmission. This is the main route of transmission. Earlier, it was the blood transmission and all. But because of mandatory testing of the blood, it has come down even less than 1%. And of course, the other groups like female sex workers, injecting drug users, these are like drivers of epidemic. But the main route of transmission still being more than 90% is the heterosexual route of transmission.
Okay, so this is we got a very basic knowledge about it. Okay, coming to you, Jahnavi Goswami, it's indeed a privilege to sit with you here, and you have become an inspiration for the women in the society. So if we talk about the scenario of HIV AIDS in Assam and particularly in Northeast, so what would be that? What would you like to tell our viewers today?
First of all, I want to thanks to inviting me as a guest. I don't know how much I work for the community, but yes, I feel I am doing some things for that. That's why today I'm here. But thing is in that if I see the trend of HIV infections is last 2 years in the Northeast is really increasing. That's an alarming situation in the Northeast.
Okay.
And especially among the youth who was injecting drug users, especially in the men's sex, having men's sex with men. These are the things is day to day is increasing day by day. It's a very alarming situation. Although that the entire epidemic says that HIV infection is going to be reduce it. But in the northeast part, Mizoram, Assam, Arunachal, other part of the northeast is really is increasing and is affect on the youth basically.
It's basically affecting the youth, and it's epidemic
Yeah.
is being spread in entire Northeast.
And
so as an activist, that what do you think, Jahnavi, that what are the awareness campaigns, are the awareness campaigns effective for the society to make them aware about the things or what they are going through and how they can control the menace?
Thing isn't that we have that lot of TI NGOs was working for this community, the targeted intervention NGOs was working for especially for men, sex with men, injecting drug users, truck drivers, and the female sex workers and all. But thing isn't that the awareness level, the IC materials need to be changed. It's still
okay.
Because
Jahnavi, I need to stop you in between.
Yeah.
We have a caller, so let's take the call and then we'll proceed with the conversation. Hello. Hello. Hello.
Hello.
আপোনাৰ প্ৰশ্নটো কৰিব
মোৰ প্ৰশ্নটো বৰা ছাৰলৈ আছিলে যে আমাৰ এই বেমাৰটো কেনেকে সংক্ৰমণ হয় আৰু ইয়াৰ প্ৰতিৰোধৰ কাৰণে আমি কি কৰিব পাৰো
হয় ইটস এ ভেৰি গুড কোৱেশ্চন
অসমীয়াতে ক'লে ভাল হ'ব নেকি?
you can reply him yes you can reply him to
ওকে অসমীয়াতে কৈছো আপোনাৰ কোৱেশ্চনটো আছে কেনেকে হয় এটো কেনেকে হয় মানে আপোনাক মই ইতিমধ্যে কৈ গৈছো যে মেইন কাৰণটো আছে হিটাৰোসেক্সুৱেল ৰুট অফ ট্ৰান্সমিশন মানে অসুৰক্ষিত যৌন সম্বন্ধ হেতুৰ কাৰণে বেছি হয় আৰু তাৰ কাৰণটো কিন্তু এইবিলাকত কিছুমান উপাদান আছে যেনেকে ধৰক আমাৰ মানে জানবি অলৰেডি কৈছে ইনজেক্টিং ড্ৰাগ ইউজাৰ্ছ যিসকলে ড্ৰাগছ লয় মেন হেভিং সেক্স উইথ মেন বা ফিমেল সেক্স ৱৰ্কাৰ আছে সেইবিলাক হৈছে কিছুমান ড্ৰাইভাৰ হয় তেওঁলোকৰ থ্ৰুৱেদি এইবিলাক আহে কিন্তু মেইন ৰুট অফ ট্ৰান্সমিশন আছে হিটাৰোসেক্সুৱেল ৰুট অফ ট্ৰান্সমিশন মানে অসুৰক্ষিত যৌন সম্বন্ধ সেকেন্ড আপোনাৰ কোৱেশ্চন আছিলে কি কেনেকে প্ৰতিৰোধ কৰিব পাৰি খুব ভাল কোৱেশ্চন কৰিছে আসলে প্ৰতিৰোধ কৰিবলৈ হলে আমি মানে সমাজৰ প্ৰতিজন ব্যক্তিয়ে আমি সচেতন হ'ব লাগিব আমি এটা মানে জাগ্ৰতা গঢ়ি তুলিব লাগিব কিন্তু ইমিডিয়েট আপোনাৰ যদি পাৰ্চেণ্ট টু পাৰ্চেণ্ট বেচিছত যাওঁ তেতিয়াহ'লে হৈছে কি অসুৰক্ষিত যৌন সম্বন্ধ নকৰাই ভাল সদায় অলৱেজ ইউজ কণ্ডম আৰু ছেকেণ্ডলি আপোনালোকে যেতিয়া ব্লাড লয় অলৱেজ ইউজ ব্লাড ফ্ৰম এ নেশ্যনেলাইজ ব্লাড বেংক এইটো সদায় মনত ৰাখিব আৰু আপুনি যি কামেই নকৰক কিয় সদায় সুৰক্ষিত হৈ কৰিব ধৰক ডক্টৰসকলে যেতিয়া অপাৰেশ্যন কৰে তেওঁলোকৰ প্ৰটেক্টিভ ইকুইপমেণ্টছ আছে সেইবিলাক তেওঁলোকে ইউজ কৰিব এইবিলাকেই হৈছে কিছুমান উপাদান মানে বিশেষকৈ সমাজৰ প্ৰতিজন ব্যক্তিয়ে আমি সচেতন হ'ব লাগিব
All right, so awareness is very important, and these are some of the important notes and important messages which, as viewers, you should note it down. And our numbers are flashed on your television screen. So if you have any queries regarding the topic which we are discussing today, please call up. And Dr. Dhrubajyoti Borah is here, Jahnavi Goswami is here, so you can call up and ask your questions, and you will get your answers. All right, Jahnavi, coming to you, awareness campaign. We were talking about awareness, how to aware those youths who are struggling for this menace.
Until and unless we are not going to be target the school and colleges because the TI NGOs, the particulars, high risk group we are targeting. Like we have to target the youth group particularly. For that we have a red ribbon clubs in the all colleges.
Okay.
From the NACO side, even the State Education Society is monitoring for that. But thing is in that how much active that the Red Ribbon Club, that's the most important things because most of the times I visited the colleges and all, I saw the Red Ribbon Club is there, but it's
not active.
Not active. People don't know how to, what the basis of how can HIV is transmitted. These things we need to be not only the TI NGOs who are working in that, as per the doctors Borah says, like we have to be, everyone needs to be consensus. It's not because of the World AIDS Day coming, we are here for the discussion sometimes. It should be discussion
but
and
this kind of discussions also aware people, but we have to make it a note, doctor, like she was mentioning about those red ribbon society, but it's not functioning or it's not that active. So what could be the reason that, did you have any time like visited those schools and colleges and have seen, you have a check on with personally, like you have seen personally and you have made an awareness among the people that you should do it like this or that way. So what, as a doctor, that how do you proceed with those things?
Yes, basically you see for kind of like to get a successful public health program, everybody should take their ownership. This is most important. For example, if it is because the Red Ribbon Clubs, it is basically in the colleges. So the college authorities should take the ownership. They should come forward. Of course, we always go there. From our AIDS Control Society Assam, they always focus on that. We have a separate component that is IEC division. So they always approach them. But the ownership should come from them. As I already mentioned, that everybody should take the ownership. Everybody should
take part and should take that initiative.
In this initiative, in this particular campaign to just to tackle HIV/AIDS. So this is the reason. Of course, we are always there.
Okay.
Anyone can come
but everyone
forward.
has to take that initiative. It's not only doctors, it's not only our activists that will be helping out and will be creating those awareness camps. But as a viewer and as a citizens, we have to take our initiatives as well to spread the awareness among the people. All right, on that note, we'll slip into a short break, but do come back soon because we have lots more on the other side. Welcome back. You're still watching A Good Life, the health show with me, Pooja, and we are having a fruitful discussion on AIDS. And we have a phone call, Doctor and Jahnavi. So let's take the phone call. Hello.
Hello.
Yes.
Hello. Hi. মই পংকজ কুমাৰ ডেকা কৈ আছিলোঁ মংগলদৈৰ পৰা।
আপোনাৰ প্ৰশ্নটো কৰিব।
প্ৰশ্নটো আছিলে যে আপোনাৰ যদি মাক বাপেকৰ ধৰা মানে পেৰেণ্টৰ যদি HIV থাকে তেনেহ'লে তেওঁলোকে যদি বেবীৰ কাৰণে কনচেপ্ট কৰে নেক্সট সেই যিটো মানে বেবী জন্ম পাব সেই বাচ্চাটোৰ HIV নোহোৱাকে জন্ম পাব পাৰি কি নোৱাৰি?
That's good.
হয় হয় মিষ্টাৰ ডেকা এইটো খুব এটা মানে ভাল কথা সুধিছে তাৰমানে কি হৈছে আপোনাৰ কোৱেশ্যনটো হৈছে মাক বাপাক যদি দুজৰাকী পজিটিভ হয় তেতিয়াহ'লে এটা কথা হৈছে কি আমি সদায় কওঁ যিমান পাৰি সোনকালে মানুহগৰাকী বিশেষকৈ তেওঁলোকৰ যেতিয়া ধৰা পৰে তেতিয়াৰ পৰা ART খাব লাগে আৰু কি হয় ART যদি আপুনি তাৰমানে ফাৰ্ষ্ট টাইম ষ্টাৰ যিটো আমি প্ৰথম মানে 3 মান্থছৰ ভিতৰত যদি তেখেতে মেডিচিন ষ্টাৰ্ট কৰে মানুহগৰাকীয়ে যদি মেডিচিন ষ্টাৰ্ট কৰে আৰু যদি নেৰানেপেৰাকৈ খায় মানে 100% ART ড্ৰাগ এডাৰেঞ্চ টিল ডেলিভাৰী য'ত অফক'ৰ্ছ আপোনাৰ কি হয় এইটো মানে লাইফ লং ট্ৰিটমেণ্ট HIV ট্ৰিটমেণ্টটো আজি ষ্টাৰ্ট কৰিছোঁ সেইগৰাকী মানুহ মৃত্যু নোহোৱালৈকে তেওঁলোকে খাব লাগে আৰু যদি 100% এডভান্স দি খায় তেতিয়া দেখা যায় যে দুইজনৰ গাতে বিশেষকৈ মাকৰ গাত মানে মানুহগৰাকীৰ গাত আপোনাৰ ভাইৰেল লোডটো চাবলৈ গ'লে আনডিটেক্টেবল হ'ব আৰু যেতিয়া ভাইৰেল লোড আনডিটেক্টেবল হ'ব আৰু শিশুটোৰ অলমষ্ট 100% শতাংশই আপোনাৰ থাকে যে তাৰমানে শিশুটো HIV নিগেটিভ হৈ পেলাই মানে জন্ম লাভ কৰিব গতিকে সেইকাৰণে হৈছে আমাৰ এডভাইচ টু দ্য পিপল ডেট যেতিয়া আমি ART ষ্টাৰ্ট কৰা যায় সকলোৱে তেওঁলোকে এদিনো নেৰানেপেৰাকৈ 100% যদি খায় তেতিয়াহ'লে শিশুটো সময়মতে খাব সদায় খাব নমৰালৈকে তেতিয়াহ'লে দেখিব যদি তেওঁ গৰ্ভধাৰণ কৰোঁ শিশুটো কিন্তু HIV নিগেটিভ হৈ পেলাই মানে জন্ম লাভ কৰিব সেইটো দেখা গৈছে
All right, thank you so much for calling and giving your valuable time and asking the question. All right, this was a very important question and we were thinking of talking on this topic. But let's talk about some technical questions, doctor. Where should HIV be tested? This is an important question and knowledge for the viewers as well.
Yes, HIV should be tested in the ICTC, that is integrated counseling and the testing centers, also the PPT cities. So, of course, I tell to all the people that please come forward and do test yourself in the ICTCs, PPT cities. Of course, the PPT city, it is basically for the pregnant women, but ICTC for all. So all the government hospitals of Assam across India, it is available even in the private sectors like our downtown hospital, GNRC, Oil India Limited, Reliance Company, everywhere it's available. ICTCs are available. Anybody can come in, anybody can come forward and they will do that test.
We have seen a hesitation among the people.
That's a voluntary test and also the free of cost. People don't need to pay for this test actually. That's a good sign for the HIVs.
But I was talking about the hesitation that people don't come easily, they don't come forward and talk about these things with their parents and with their friends as well. But what is the reason behind it and what would you like to tell those people that you should come forward and you should at least talk to your close ones if you're not able to talk to everyone, maybe to your doctor?
Yes. No, actually what happens if a particular person in a family found it positive, generally the family members, first of all, suppose if the wife is positive, then wife tries her best to bring her husband. Then once both the parents are positive, then they bring the children. Of course, we are there. Our counselors are always there. They always advocate. They always give advice that please bring a family members. So it is one. Secondly, we should also encourage our friends and families. We should always disseminate, including you, including myself, including Janavi. Means whatever from the community or from as a whole.
Okay.
Yeah, from the general population, we should always advocate. We should always encourage people to come forward. So this is the reason. Of course, I have seen if anyone in the family is found positive, then entire family should be tested.
Okay, so this is one. So as an activist, Janavi, what would you like to tell her?
Also, I feel that that's the trauma between there's not only a stigma, there is a trauma between that HIV and other disease. If I have the diabetic, then there is a no trauma. If I have a hepatitis positive, there is a no trauma. But route of transmission and hepatitis and HIV is almost same.
Yes.
Okay.
But discrimination in HIV is quite high. People think that because hepatitis, people don't know how to transmit it. That's the things, because people are not aware. And HIV is aware because of the sexual transmitted disease, because other things isn't they forgot.
Yes.
The blood transmission or my parents to child transmission, there's other things is they forgot. They only stick on the character and my disease.
Character and the disease, and maybe this is because of the lack of awareness, because
Lack of
we have
awareness.
seen, and not only about the illiterate people we are talking,
Literate people.
Some literate people, many literate people are
many
also
literate
not making them
I want to say
aware, or
that
they are not able to accept those things, that this is nothing, you can come up, open up and talk to your doctors easily,
correct.
and the test has been done free, so why not?
Even medicine is free. Not only
Medicine is
test
free,
is
everything.
free.
Medicine
The
test,
entire test is a first. This is a first state of the Assam.
Okay.
That entire test isn't free, including even medicine is free.
All the laboratory investigation was made
All
free in
the-
Assam.
free in Assam.
Means
In
the
This
first
has
state in
become very
India.
easy for the viewers as there, and you are listening to our show and you are being listening to
And
doctors. And
also-
these are some of the important messages which is being conveyed to you. So what are the other things like we would like to tell our viewers as well?
Not only the HIV medicine, there are some people who are not willing to come for the for the government hospital due
Okay.
to RAS and all. And recently, Dr. DJ, me and other people who have opened one clinic, at least who are not willing to go for the government hospital, it's called the Apexa Healthcare Center.
Okay.
So for that also you can take this treatment. At least you can take the treatment because undetectable is untransmittable.
Do they have a wrong?
Difficult to
Yeah.
do.
Do they have a wrong notion about government hospitals that they will be going there and they
Well,
will
basic-
might
basic,
get
yeah,
infected?
yeah.
So those are some of the myths like
Myths,
people are thinking.
myths.
Yes. So these are some. So let's talk about treatment, doctor. As we are really having a short of
Yes, yes,
time, so
short of
let's
time,
just
yes.
have a talk on the treatment as well.
Yes, as I already said, the HIV treatment is absolutely free. It is called ART, antiretroviral treatment.
Okay.
At present, we have in NACO, we have first line treatment, second line treatment, and as well as the third line treatment is free. Fourth line is still not available. It is available in developed states like US and all.
Okay.
So whenever a patient is found to be HIV infected, of course, as she already mentioned, that we have to do some baseline investigations, including CD4 count. CD4 it is basically lymphocyte cell of our blood. So we do all the required investigations. Then accordingly we start the treatment. Treatment is giving, and always we advocate that once you are starting on the treatment, the particular person should take the medicine on the same time of the day, and it is a lifelong treatment. And it has been seen that if the patient continues with a good adherence, then the viral load is low. Basically, what happens when the patient starts treatment, when the patient suffers from HIV, viral load increases and CD4 falls down. But when the ART started, then
It's
it becomes reverse, vice versa.
Okay.
Then your viral load will come down, CD4 will increase, so that no other opportunistic infection gets up. So, this is the crux in HIV. So what happens? Because many people think that people die of HIV. No, people die in HIV because of other opportunistic infections.
Other opportunity infection and because
mainly
like,
tuberculosis.
medicines are not get
Yeah,
continued.
not get continued.
Doctor, we have a phone call. Let's take the
Okay.
phone call. Hello.
Hello. Yeah, myself Anindita Chaudhary. I'm calling from 6 Mile.
Okay.
Happy to be part of this talk show. Well, I would like to know what are the societal norms, like how society can play a role to tackle HIV, because we know there are lots of myths and evil myths.
All right.
How
Jahnavi,
the
as a-
society can play a role?
Yeah, either Dr. Truba or Jahnavi ma'am can be a
Yes.
part of that.
Okay.
Because, ma'am, we are equally responsible to do the awareness campaign. Because as of now, what we are doing it's only the who are walking and closely associated with HIV, we are doing it. So college teachers, students, household people, they all needs to be aware, all needs to be take care for the entire communities and all. So people should be included for each and everyone. That's only you can do it. Otherwise, it is very difficult for us, at least to make that mass awareness campaign. So I requested, madam, if you become a part of it, I'll be very happy.
All right, that was a very good gesture
Yeah.
from you, and I'm sure the viewer who is just listening to Jahnavi must be aware that what she was trying to tell you, and it's very good that we get more people and so that we can aware more people in the society as well. All right, we have another caller waiting. Hello?
Hi.
Yeah, hello?
Hi, I would like to speak to the doctor.
Yes, yes, he's listening to you. Please ask your question.
Yeah, please.
Yes, hi. Actually, my name is T. Malik and I'm calling from Rangia.
Okay.
Yes, so I would like to know whether in terms of if a patient is HIV positive and the same, she a pregnant woman and she delivers a baby, and if it's positive, so she can breastfeed the kid or not?
Okay, good question. Yes.
Good
yes.
question.
Yes, Mr. Malik. The point is that yes, definitely we will advocate as per WHO guideline, our NACO guideline, the baby should be breastfed. But yes, if I tell you technically, scientifically that suppose if person, mother is on ART drugs, continuously on ART drugs, and she gives breastfeed to the baby, then in that case, the rate of transmission is, it is 1%.
Okay.
So, sorry, 2%. But if she is taking ART drugs but not giving breastfeeding to the baby, then chance of rate is 1%. So it is 1%. So that means if she gives her breastfeeding, it is 2%. Although it is, but now the crux is there. Although it is 2% with breastfeeding, without breastfeeding 1%. But the point is that with the 2%, what happens? The baby may not die. After 5 years also, baby will live longer. Because what? The baby will be protected from all the vaccine preventable diseases. But that baby who was fed on from the first day itself, baby was put on artificial feeding. The baby may die of all these measles, DPT, all this means vaccine preventable
other
diseases, mainly the respiratory tract infections. So this is the important point. In case of second baby, the baby may not see the 5th birthday, but for the first baby who was given breastfeeding, the baby will live longer. So that's why we advocate always give breastfeeding, exclusive breastfeeding up to 6 months. If the baby, of course, we do the first testing at the age of 6 weeks. If the baby is also found to be infected, then we must continue the breastfeeding for 24 months.
All right. As we are getting really short of time, so I would like to ask a doctor and Jahnavi as well. So as this is the week of World International AIDS Day, so your message to the viewers, what would be that? Starting with you, doctor.
Yes. My message is that, first message is that, please pass this message that come forward for HIV testing. Although, not only yourself, if you're adult people also, you, whenever your children are supposed, they may be studying abroad or outside Assam. Always include everyone. Come forward, do HIV testing, number one. Number two, once a person is found to, of course, you encourage your friends and families. Secondly, if a person is found to be HIV infected, please come forward, take the, get registered in the ART centers or in the private setup, wherever you are, but continue the medicine till you die. Please continue the medication. Number third, do not do any kind of, overexcited or some kind of means you go to some kind of behavior, high-risk behavior. If you go also, always keep in mind that always use condom. This is most important. This is my message.
All right. And Jahnavi, your thoughts and how you're going to inspire those women.
My thought is like we have almost approx like 17,468 people living with HIV in Assam. And only the 7,900 people are approximately like taking in medicine, but there's a lot of gap. So what I requested it, who was just looking after this show right now, because I am taking an ART for last 14 years, I am living with HIV last 27 years. So I requested, if I am not taking medicine, I want to be here today. So I requested all of you who has not taken medicine and looking this show is right now in front of the TV, I requested you all, please come, take your medicine on regulars and live longer like me.
All right, it's really nice and it's really like encouraging for all the viewers out there that you have come forward with those kind of messages. And thank you, doctor, for enlightening us with the topic and about the important topic. We couldn't touch it. There were lots of questions to be asked, but time is not allowing us. But thank you so much. Thank you so much, doctor, for coming to our show. And thank you, Jahnavi, for being a part of this show today. And with this, we have come to the end of the show, and we hope that we were able to answer all your queries in the best possible way. And in our next episode, we will be discussing on some other health issues. So if you have any queries, please do join us next week. And till then, stay happy and stay healthy. Keep watching Northeast Live. Goodbye.